Tonight we're talking to Dr. Melidonian about what happens in the ER, and a lot of questions are being asked. We went out on the cyber world and we asked on Facebook and also on Twitter what you wanted to know, and here are going to be some of your answers.
I was really interested in this one. It's very timely because, of course, we heard about the outbreak of hantavirus at Yosemite, and Steve R., who is a Glendale resident, asked about the outbreak at Yosemite. He'd visited there recently, and he wants to know what the hantavirus symptoms are and what causes it.
Hantavirus is typically transmitted by droppings or saliva with mice, rats, rodents of all types. The recent outbreak is kind of the most important part of the history, is that you need to say you were exposed at a location where you would have been exposed to rodent droppings. The typical way it happens is when you're cleaning areas that you see rat droppings or mice droppings. If you inhale it at that time, or if you are in direct contact with the urine or the saliva of the rodent, then you can transmit the disease. The typical symptoms, the hardest part about this is the initial symptoms. You'll see fever, fatigue, malaise, a lot of aches and pains in your muscles, the bigger muscle groups, sometimes in the shoulders. Those symptoms are across the board. Everybody who is infected with hantavirus will have that. Wow. But they're very similar to influenza. So it's hard to diagnose.
Not about that, but it's like there's sometimes I got a lot of responses on Twitter, and Deb asked, how do you know if you're suffering from a heart attack opposed to heartburn? Like, do you still go in if you think it's heartburn into the emergency room?
One of the most common symptoms that people have is the chest discomfort, and they attribute it to heartburn, thinking that that's what it is. But that's how we see a lot of people have heart attacks and they don't survive. They think they're treating their heartburn and they miss the diagnosis. Unfortunately, there are doctors that will treat them and say, you know, you're 40 years old, you're not at risk, and they misdiagnose it as heartburn, and sometimes they don't do well afterwards because it's a wrong diagnosis. So until you have the first diagnosis, until you have a full workup to make sure that it is not a heart attack, then you cannot say that this is just heartburn. You really need to make sure that that's not.
And you can test to see if somebody's had a heart attack, right? You can take a blood test?
We do blood tests. We have turnarounds of less than an hour now with blood tests that we can check to see if you have had a heart attack, if there's been injury to the heart. I actually just diagnosed somebody yesterday in his 40s who had a heart attack, and it was truly based off that blood test. Normal electrocardiogram, normal exam. The history sounded concerning, which is why I ordered the test, and then get a positive result, and
saved his life.
Saved his life, yeah.
Now, Jennifer's the Twitter queen. On Twitter, didn't you get some inquiries about heart attack symptoms in women?
Yes, I did actually. They wanted to know how to.
No, you can never read a woman in anything. You really can't read them. You really can't read them with a heart attack. Women have very different symptoms. Women typically will say, I just feel tired. I just don't feel like doing anything.
Anxiety.
And the men will typically say, oh, sure, you're depressed or you're hormonal and that's what's wrong. And if you do the correct workup, you'll see that they are having a heart attack.
These tests can really take the guesswork out of, don't sit and wonder if you've had a heart attack. Go to the ER, find out, get the proper test, get the proper treatment. We'll be back with more of our viewer questions here on HEALTHline. Stay with us.
Hi, I'm Serineh Melidonian, emergency physician at Glendale Adventist Medical Center, and I'm here to give you a health tip on Halloween safety. Preparation for Halloween begins with finding an appropriate costume. Make sure that the costume is not completely black, that you add reflective material to the costume to make sure that the clothing is visible. Make sure the masks are fitting properly so that your child can look down, look around. Make sure that you're using a path that is with sidewalks, well lit. After collecting the candy, make sure you inspect it and that there's nothing that is unwrapped. It's also very important to know where your children are. I'm Serineh Melidonian, and I hope that you have a happy and safe Halloween and stay away from an emergency department.
Hi, my name's Kevin Roberts. I'm the president and CEO of Glendale Adventist Medical Center. I want to tell you about our website. Our website at glendaleadventist.com has health tips. It has places for classes and education for you and your family. It has a way to find doctors. It has a way for you to learn about the different services that we provide at Glendale Adventist for the whole person. We cover the whole range, and we are here for you.
Welcome back, everyone. Tonight we're answering Cyberworld's questions to the emergency room Dr. Melidonian.
I have one from Steve L. in Pasadena, and he posted on our Facebook page the following. When you enter an ER with what you believe is a serious problem, such as heart attack or stroke or abdominal pain, what is the best way to convey your concern to be seen immediately by whomever you're directed to see?
Well, fortunately at Glendale Adventist, you'll see a triage nurse as the primary line, but they will direct you in very quickly, and you'll be seeing a doctor within the 30 minutes for sure. Mm-hmm. The best thing to do is just try to describe your symptoms as best you can. Mm-hmm. Don't tell us that you need a CAT scan or you need this or that. Don't try to direct your care. We'll take care of that part, but just tell us what you're feeling. If you can bring a friend or family member with you, if you need a translator, that would be fantastic to help us out. But just convey what you're feeling, and we'll take care of it from there.
Dr. Melidonian, what do people need to do, know, or bring when they go into the ER?
So if you don't speak English, bring a translator. At Glendale Adventist, we have other languages that we can speak to our patients, but as the physicians, but just help us out with a translator if you can.
You imagine you speak Armenian, Spanish, Tagalog. I mean,
English. English. I, for one, speak all Armenian, English, and Spanish to my patients, and I'll do them next to each other and make everybody be surprised that the same person speaking three.
Lifesaver and linguist.
But we also have Tagalog, we have Chinese, we have Farsi, so we do have different languages, and we can get translators, but it is a lot easier if you bring somebody who's your family member who can help us out with that.
Do you bring your meds?
Bring your list of medications. You should always carry a list of medications. Yes. If you have medical problems like seizures or diabetes, get a medical alert bracelet. But otherwise, keep a list of your physicians, your family members that we should contact just in case of an emergency, and then, of course, your list of medications, your vitamins that you take. If you're coming to the emergency room for a broken ankle, or a sprained ankle or something of that sort, if you're not going to be needing emergency surgery, then bring a snack, bring a drink of water. So, because we have some of that, but we don't have it easily accessible to you. Bring some entertainment, an iPad, games to play. If you have children with you that you're bringing in, bring something for them to feel at home. If it's a blanket, a teddy bear, things of that sort.
All right. Any other advice that you might have for our viewers if they're going to the ER or they're accompanying a friend, perhaps?
Be as accommodating to our schedule. There are emergencies. We are attending to your needs, and we are thinking about you. When you see us on our computer, we're working for the patients. We may not be at your bedside the entire time, but we're taking care of you as fast as we can. So be a little bit understanding if we're not right there. And then, most important thing, when you go home, follow up with your own physician. Make sure that you make an appointment with your primary care physician afterwards.
How can people avoid the emergency room?
The best thing is if you can wait till the next day to see your doctor. Call your doctor. They know you better than having to tell me the story for the first time. But if you can't, then we're happy to take care of you. That's what we're here for, especially on Friday evenings, Saturdays, Sundays, that we're the place that you're going to be coming.
And on a full moon?
And on a full moon, of course.
All right. Dr. Serineh Melidonian, ER doctor at Glendale Adventist Medical Center. Thank you so much for coming in and talking about this.
Thank you.
This is really interesting, and we hope to only see you in this casual capacity and not in the professional one.
I know.
I never wish for somebody to see me at work. So.
Right. I'm Suzanne Watley along with Jennifer Jimenez, and we invite you to participate at facebook.com/GAMC HEALTHline. Get in on the discussion. In the meantime, thanks so much for watching our show.
Good night.